I'm John Shaw, the Deputy Chief Executive Officer of the Parkinson's Action Network. The Parkinson's Action Network is the umbrella group Washington voice that represents the more than 1 million Americans living with Parkinson's disease today, as well as representing the other Parkinson's organizations, some of which you've heard about, such as the Michael J. Fox Foundation, the National Parkinson's Foundation, and the Parkinson's Disease Foundation. Today's issue of therapy caps in Medicare deeply affects Parkinson's patients. Parkinson's patients benefit from all three types of the therapy we're talking about today: speech, occupational, and physical therapy. And that's because Parkinson's really causes many symptoms, including slowness of movement, postural instability, impaired balance and coordination, difficulty in swallowing, chewing, and speaking. So please keep in mind as we're talking about this, we're talking about literally medically necessary therapy here. For example, we're talking about the ability to swallow. It's hard to imagine much more medically necessary than that. Let me also emphasize that we're talking about therapy that both provides invaluable benefits to patients' way of life, but also does so in a cost-effective manner. And let me give you an example. One of our patients up in Minnesota, Parkinson's patient up there, she was able to delay the use of her Parkinson's medication for a full year through the use of physical therapy. This is hugely important in the Parkinson's world because Parkinson's medication, which often comes with, frankly, extremely harsh side effects, only works for 5 to 8 years. Works pretty good for 5 to 8 years, but then after those 5 to 8 years it stops working and that's it. There's nothing else left for you. So delaying the time where you start that medication is extremely helpful and cost effective. With Parkinson's, we really only have one 50-year-old drug, and in certain cases, deep brain stimulation, brain surgery. That's it. Those are the only options. So for Parkinson's, therapy is literally a lifesaver. And no doubt about it, this therapy is expensive. With one of the most successful therapy programs, a very intensive program called LSTV, one session alone of this therapy costs more than the entire yearly cap amount. So not only do we need medically necessary exceptions for this cap amount, but probably one thing is getting lost in this conversation today. The amount that was set was in never any way particularly realistic to begin with. And make no mistake, we're talking about a lot of patients. We estimate at least 500,000 Medicare patients with Parkinson's disease today. And in 2006, almost 26% of those Medicare beneficiaries diagnosed with Parkinson's surpassed the cap threshold. That's a big number. And you can easily do the math. If you're taking 500,000 Medicare patients, 26% surpassed the cap during the course of the year, you're talking about a lot of folks. We're already hearing from clinical centers across the country that potentially thousands of Parkinson's patients have been already cut off from the rehabilitation services needed to improve their quality of life. None of us in Washington here today should lose sight of this fact. The therapy caps that went into effect on January 1st have undeniably taken a large human toll. Please, on behalf of patients, let's not repeat this on March 31st. Thank you.